This lecture will be discussing about trachoma. Now, by definition, trachoma it is a chronic keratoconjunctivitis. Okay, kerato meaning cornea and conjunctiva referring to the conjunctiva. Now, it is a chronic keratoconjunctivitis primarily affecting the superior epithelium of the conjunctiva and the cornea simultaneously. And it is one of the leading causes of preventable blindness in the world. Okay, so definition, remember, it is a chronic keratoconjunctivitis. Now, the etiology. Now, it is caused by the organism Chlamydia trachomatis bioartric. Okay, now this organism, it is epitheliotropic and it produces intracytoplasmic inclusion bodies called HP bodies or Halberstater Provazek bodies. Now, the predisposing factors for infection by Chlamydia trachomatis are age, infancy and early childhood. Number 2, dry and dusty weather, and number 3, poor socioeconomic status. The source of infection, it is the conjunctival discharge of the affected person, and the modes of infection are direct spread via airborne or waterborne route, vector transmission through flies, and material transfer through contaminated fingers of the doctors, nurses, or contaminated tonometer, towels, handkerchief, etc. Okay, so again remember, under etiology the causative organism is Chlamydia trachomatis, and it produces peculiar intracytoplasmic inclusion bodies known as HP bodies or Halberstater Provazek bodies. The predisposing factors are age, dry and dusty weather, and poor socioeconomic status. The source of infection is the conjunctival discharge, and the modes of infection are direct spread via airborne, waterborne modes, vector transmission through flies, and material transfer. Now, coming to the clinical features. The clinical features of trachoma can be described under two phases. The first is the phase of active trachoma, and the second is the phase of cicatricial trachoma. Now, let us discuss the phase of active trachoma first. Now, it occurs during childhood due to active chlamydial infection. Now, the symptoms are first there is pure trachoma, and then there is trachoma in the presence of secondary bacterial infection. Now, in pure trachoma, the symptoms are mild foreign body sensation, occasional lacrimation, slight stickiness of the lids, and scanty mucoid discharge. And this can be remembered by the mnemonic MOS. Okay, so mild foreign body sensation, occasional lacrimation, slight stickiness of the lids, and scanty mucoid discharge. So these are the features of pure trachoma. Now, these symptoms, these are so mild that it is often neglected. Now, in the presence of secondary other bacterial infections, the symptoms include there is foreign body sensation, blurring and gritting, there is mucopurulent discharge from the eyes, there is sticking together of the lid margins with a discharge during sleep, and fourth, there is blurring of vision and colored halos. Okay, so remember the MOS features, that is mild foreign body sensation, occasional lacrimation, stickiness of the lids, and scanty mucoid discharge. All of these are exaggerated in the presence of secondary bacterial infection. So we have foreign body sensation, gritting and blurring of vision, mucopurulent discharge, sticking together of the lids with discharge during sleep, and colored halos. So these are the symptoms of active trachoma. Now, coming to the signs. Now, signs can be divided as conjunctival signs and corneal signs. Now, the conjunctival signs are, first is the congestion of the upper tarsal and fornicial conjunctiva. Second is the presence of conjunctival follicles. Now, these follicles, they resemble boiled sago grains, and they are commonly seen in the upper tarsal conjunctiva and the fornix. Now, if you look into the pathology of the follicles, the central part of each follicle consists of histiocytes, lymphocytes, and Leber cells. Now, the third conjunctival sign is the papillary hyperplasia. Now, these are red, flat-topped, raised areas which give red and velvety appearance to the tarsal conjunctiva. So, remember the conjunctival signs are congestion, conjunctival follicles, and papillary hyperplasia. The second sign is the corneal signs. Now, the corneal signs include superficial keratitis, Herbert follicles. Now, remember, conjunctival follicles, if seen in the limbal area, these are known as Herbert follicles. Third is the presence of progressive pannus. Now, pannus refers to the infiltration of the cornea associated with vascularization seen in the upper part. And fourth is the corneal ulcer. Now the important corneal signs is Herbert follicles and progressive pannus. Okay, so again we've discussed the symptoms of active trachoma and the signs. The signs can be divided as conjunctival signs and corneal signs. Now, the important conjunctival signs are congestion, conjunctival follicles, and papillary hyperplasia. Now the important corneal signs are Herbert follicles and progressive pannus, and along with this we've discussed superficial keratitis and corneal ulcer. Now if you look into this diagram, so this is the diagram you have to draw for your exams. So it shows that the conjunctiva, there is congestion, there is presence of follicles, and there is presence of papilla. Remember, in the histopathology of the follicles, the peculiar cells seen are lymphocytes and Leber cells, and papilla are the flat raised areas with red velvety appearance. Then the corneal signs, we have progressive pannus and the Herbert follicles, and this is the clinical picture showing the follicle congestion, the presence of follicles, and papilla. The next is the phase of cicatricial trachoma. Okay, cicatricial referring to healing. Now this stage it manifests during middle age. Now again it has conjunctival signs and corneal signs. Along with this there is lid signs and lacrimal apparatus sequels. Now the conjunctival signs are, remember, it is the phase of healing. So whatever signs we have in the active trachoma, the healed versions of those signs are seen in cicatricial trachoma. So in conjunctival signs we have conjunctival scarring, concretions, that is hard whitish deposits varying from pinpoint to 2 mm in size, and other conjunctival sequelae like sclerosis and pseudocyst. Okay, so this diagram here, this here is the concretions, and remember these are hard whitish deposits varying from pinpoint to 2 mm in size. Now the corneal signs are regressive pannus, Herbert pits, corneal opacity, and other corneal sequelae like ectasia, xerosis, and total corneal pannus. Next is the lid signs, and the important lid sign is trichiasis. Then others include entropion and tylosis. Tylosis referring to the thickening of the lid margin. And finally lacrimal apparatus sequelae like chronic dacrocystitis and chronic dacroadenitis. So again, the phase of cicatricial trachoma, we have, along with corneal and conjunctival signs, we have lid signs and lacrimal apparatus sequelae. Now the conjunctival signs are scarring of the conjunctiva, concretions, and xerosis, pseudocyst, etc. And the corneal signs are regressive pannus, Herbert pits, corneal opacity, and ectasia, xerosis, and total corneal pannus. And in lid signs, the important one is trichiasis, others are entropion and tylosis, and the lacrimal apparatus sequelae like chronic dacrocystitis and chronic dacroadenitis. Now this shows the clinical pictures of cicatricial trachoma, and you can see the concretions and the Herbert pits. So that concludes the clinical features of trachoma. Remember, it is divided as active trachoma and cicatricial trachoma. Now coming to the World Health Organization classification, the WHO classification of trachoma, and you can remember it by the mnemonic FISTO. The first is the trachomatous inflammation follicular. Now this is a stage of active trachoma with predominantly follicular inflammation, and this stage is diagnosed if there is at least 5 or more follicles greater than 0.5 mm in diameter, and they should be present in the upper tarsal conjunctiva. So this is the first stage, that is the trachomatous inflammation follicular. Second is the trachomatous inflammation intense. Now this stage is diagnosed when there is profound inflammatory thickening of the upper tarsal conjunctiva. Third is the trachomatous scarring. Now this stage is diagnosed when there is presence of scarring in the tarsal conjunctiva. So this here is the trachomatous inflammation intense, and this here shows the scarring in the upper tarsal conjunctiva. The fourth stage is trachomatous trichiasis. That this is diagnosed when at least one eyelash rubs against the eyeball, and you can see here, this here is the trachomatous trichiasis. And the fourth stage is corneal opacity. Now this stage is labeled when an easily visible corneal opacity is present over the pupil. Okay, so again, under WHO classification we have fisto, trachomatis inflammation follicular, trachomatis inflammation intense, trachomatis scarring, trachomatis trichiasis, and finally corneal opacity. Now the complications of trachoma, now the only complication of trachoma is the formation of a corneal ulcer. Now coming to the diagnosis, now diagnosis can be made according to clinical history, and this is based on the WHO classification which we've already discussed. And the second diagnosis is the laboratory diagnosis. Now here conjunctival cytology can be done. Now GEMSA staining shows presence of lymphocytes and Leber cells. Remember that this is typical of these cells are seen in the conjunctival follicles. The second is the detection of inclusion bodies by GEMSA staining. Remember the characteristic inclusion bodies seen in infections by Chlamydia trachomatis is the HP bodies. Now this can be done using GEMSA staining, iodine stain or immunofluorescence staining. Next is the ELISA or PCR for detection of the chlamydial antigens. Then is the isolation of the chlamydia, which is possible by yolk sac inoculation method, and finally it is serotyping. So diagnosis, remember clinical diagnosis based on WHO classification, and laboratory diagnosis using conjunctival cytology, detection of the inclusion bodies, ELISA, PCR, isolation of the chlamydia using yolk sac inoculation, and finally serotyping. Now let us look into the treatment. Now the treatment for active trachoma. Now active trachoma refers to the WHO stages, trachomatis inflammation follicular and intense. Now here topical antibiotic therapy is the main mode of treatment. Now you can remember the drugs as, so remember it is called trachoma. Just remember trachoma. Okay, so the drugs are tetracycline and erythromycin. Now the topical antibiotic therapy, tetracycline 1% or erythromycin ointment twice daily for 6 weeks. So this is the topical antibiotic therapy. Now the systemic antibiotic therapy is again tetracycline or erythromycin 250 mg orally 4 times a day for 3 to 4 weeks. Or instead of tetracycline we can give doxycycline 100 mg orally twice a day for 3 to 4 weeks. Now the third mode of treatment is combined topical and systemic antibiotic therapy involving tetracycline, erythromycin, eye ointment, and oral azithromycin. Okay, so again remember the drugs as trachoma. T for tetracycline, E for erythromycin, and A for azithromycin. Now topical therapy, it involves tetracycline 1% or erythromycin eye ointment for 6 weeks, twice daily for 6 weeks. Systemic antibiotic therapy is again tetracycline, erythromycin 250 mg orally 4 times a day for 3 to 4 weeks, or doxycycline. And the combined topical and systemic therapy involving tetracycline, erythromycin eye ointment along with oral azithromycin. So this is the treatment for active trachoma. Now treatment for cicatricial trachoma, and this involves the WHO stages of trachomatis scarring, trachomatis trichiasis, and corneal opacity. So basically it is the treatment of these three clinical features. The first is that the concretions can be removed using a hypodermic needle. And remember, concretions are the conjunctival signs seen in cicatricial trachoma. Then xerosis can be treated using artificial tears, and trichiasis can be treated by using lash removal by electrolysis or cryolysis, and finally corneal opacity is treated by keratoplasty. Now the prophylaxis for trachoma by the World Health Organization is the SAFE strategy. Now S stands for surgery for trichiasis or entropion, that is tertiary prevention. A is basically secondary prevention, that is use of antibiotics. F is facial hygiene, that is primary prevention, and E is environmental changes, and this is the primordial prevention. Okay, so this concludes our discussion on trachoma, and we've discussed the important headings. The definition, that is the trachoma, it is a chronic keratoconjunctivitis. The etiology, agent is Chlamydia trachomatis biovartric. Source of infection is the conjunctival discharge of the affected person, and the various modes of transmission we've discussed. The clinical features we divided at active and cicatricial trachoma. The active trachoma, it involves the symptoms, the MOS for pure trachoma, and the exaggeration of the MOS symptoms for trachoma along with secondary bacterial infection. Then the signs include the conjunctival signs and the corneal signs. The conjunctival signs are congestion, conjunctival follicles, and papillary hyperplasia, and the corneal signs are, the important ones are progressive pannus and Herbert follicles. And in cicatricial trachoma we discussed along with the corneal and conjunctival signs, we discussed the lid signs and the lacrimal apparatus sequelae, the WHO classification, Fisto. Next we discussed the complication, and remember the only complication is corneal ulcer. Next, diagnosis via clinical history and laboratory diagnosis, and finally the management, that is the treatment and the prophylaxis. And now treatment, remember the drugs: trachoma, tetracycline, erythromycin, and if it's a combined of systemic and topical antibiotic, we use azithromycin as well. So this concludes our lecture on trachoma.